What happens if chemotherapy does not work? Hello, and welcome to our video. Chemotherapy is one of the most common treatments for cancer. For some people, it shrinks tumors, slows cancer growth, and even sends the disease into remission. But what happens when it doesn't work? What if the cancer keeps growing, or comes back stronger? This is a question many patients and families face. And while it's never easy, it's important to know, when chemo doesn't work, it doesn't mean all hope is lost. It simply means it's time to explore what comes next. Let's start by understanding what doctors actually mean when they say chemotherapy didn't work. It doesn't always mean the treatment failed completely. It simply means the cancer didn't respond as expected. Sometimes, doctors can tell the chemo isn't working because the tumor doesn't shrink at all, even after several cycles. In other cases, the cancer may continue to grow, or new tumors may appear elsewhere in the body. That could mean the cancer has become more aggressive, or that it's spreading despite treatment, a process called progression. There are also cases where chemo seems to work at first. Maybe the tumor shrinks or symptoms improve, but after a few months, the cancer returns. This is called a recurrence, and it can happen because some cancer cells survived the initial treatment and later started growing again. In some situations, the cancer becomes resistant to chemotherapy over time. That means the cancer cells have figured out how to block or expel the drugs, making them less effective. This can happen with certain aggressive cancers or in later stages when the disease has had more time to adapt. But here's something important to remember. Just because the chemo didn't stop the cancer doesn't mean the treatment was a mistake. Chemo may have slowed things down, relieved symptoms, or bought time, all of which can still be meaningful outcomes. It also doesn't mean that there are no other options. Every cancer behaves differently, and this stage simply marks a point where your doctor will need to reassess the plan, whether that means switching to a different medication, trying a newer type of treatment, or focusing on comfort and quality of life. In short, when chemo doesn't work, it's not the end of the conversation. It's the start of a new one. When chemotherapy doesn't work, it can feel like the road ends. But that's not the case. Your medical team doesn't stop trying. Instead, they shift gears and explore what's known as second-line or even third-line treatments, alternative strategies that may still help control the cancer or improve quality of life. Sometimes this means switching to a different chemotherapy drug or a new combination of drugs. Even if one type didn't work, another might, especially if the cancer has certain biological features that respond better to specific drugs. Another option may be targeted therapy. Unlike traditional chemo, which attacks rapidly dividing cells in general, targeted therapy works by blocking specific genes or proteins that cancer cells rely on to grow. If your cancer has a known mutation like BRCA, HER2, or KRAS, your oncologist may test your tumor to see if a targeted drug could be a match. There's also immunotherapy, which doesn't attack the cancer directly. It boosts your own immune system to do the work. This approach has shown promise in some types of cancer, especially when the tumor has certain markers that make it visible to immune cells. It's not a fit for everyone. But for some patients, immunotherapy can lead to long-term stability or even remission. If your cancer is causing pain or pressing on vital organs, radiation therapy might be added, not to cure, but to reduce symptoms and improve daily function. In other cases, if the cancer is mostly in one place and the patient is strong enough, doctors might recommend surgery to remove part of the tumor, even after chemo has stopped. And then there's clinical trials, a very important option that's often overlooked. These are carefully controlled studies that test new treatments, many of which are not yet available to the public. Some trials combine existing treatments in new ways. Others test brand new drugs that could be more effective than standard therapies. Participating in a clinical trial is not a last resort. It's often the next frontier. In fact, many of today's most effective cancer treatments were once available only in trials. Your doctor can help you find trials that are a good fit based on your type of cancer, location, and health status. So, when one treatment path ends, remember, it's not the end. It's a transition point, one where your care team will explore every remaining option to help you live longer, feel better, or both. Now, sometimes the focus of treatment shifts, not because we're giving up, but because we're choosing to prioritize quality of life. This is where palliative care comes in. It's not just for the end of life. It's about controlling pain, managing side effects, improving sleep, easing anxiety, and helping people feel more like themselves again. For some, that means continuing other treatments while using palliative care to stay strong. For others, it may mean stepping away from aggressive therapy and focusing fully on comfort, dignity, and time with loved ones. In either case, the goal is the same: to give the patient the best possible experience, emotionally and physically. Hearing that chemo didn't work can bring a wave of emotions: fear, anger, sadness, even numbness. That's normal. Whether you're the patient or the caregiver, this is heavy. It's okay to grieve, it's okay to question, and it's okay to take time to process what's happening. But don't do it alone. Talk to your medical team. Lean on family and friends. Ask for a counselor or a support group. You're not weak for needing help, you're human, and your emotions are just as important as your physical care. When chemo doesn't work, it's easy to feel like the road is closing in. But the truth is, there are still paths ahead. Medicine is always evolving. New treatments are being approved every year. Even if one door closes, another may open. And even if the focus shifts from cure to care, that doesn't mean there's no value or purpose left in the journey. Life, in every stage, still holds meaning. Time with family, small joys, quiet mornings, laughter, faith, love. None of that disappears when treatment changes. If this video helped you understand more about what happens when chemo doesn't work, please give it a like and share it with someone who may need this information today. You're not alone, and your story isn't over. Please don't forget to subscribe and click the notification bell. And if you'd like to support this channel, consider sending a super thanks or checking out our merch below. Take care of yourself, and take things one day at a time.